So we'll get started with today's Gallatin County COVID-19 press call. Today we have Lori Christenson, the Gallatin City County Health Officer. We have Tracey Ellig, who's the Vice President of University Communications for Montana State University. And we have Kallie Kujawa, who's the Bozeman Health COVID-19 Incident Command Lead. I'll turn it over to Lori. Lori, if you're talking, we can't hear you.
I was not talking yet. I was struggling with my screen share this afternoon or this morning, excuse me. Okay, thanks everyone for joining us today. Again, my name is Lori Christenson, and I'll go ahead and start off with our weekly surveillance report. So we'll start with figure 1 here. This is our daily and 7-day average of COVID-19 cases per 100,000. And let me get this a little bit bigger. Sorry, guys. All right. So the 7-day rolling average of daily cases per 100,000 residents was 257.2 cases per 100,000. That was as of 11/12. So we're looking here at the far end of the curve here. This represents about a 22% increase from the previous week. And what I shared last week, and I'll share again this week, we are still entering cases. We're doing the best we can to keep up with the current demands. So we add cases as we go. So I just want to reference this sort of what appears to be, a little bit of a downward curve here on this. Is not representative of the data that it is representative of what we have available in this data set. However, we are continuing to add new cases. So just be aware of that. And the message is we have very high community transmission and a lot of cases in our community right now. The daily and 7-day average of % positive cases, again, we're seeing a pretty significant number of our tests that are being run here in Gallatin County returning positive. That's about 1/3 of the tests that are occurring right now are coming back positive. So you can see that that's upwards to, we're at 32.8% on 11/11. Or excuse me, January 11th. And that's about a 14% increase from what we reported on 1/4. Specimen collection time is still 1 day, median time turnaround. So that is good. We want to continue to see that. And I'll skip to this figure here. So figure 5, last week we reported kind of a 50-50 split in terms of those individuals who would be considered a breakthrough case and versus those cases amongst the unvaccinated or those who are not fully vaccinated. And what I want to remind everyone here is these are cases that have been reported to us. So there's always a possibility that there are additional cases amongst those that are unvaccinated or vaccinated. So I just want to be aware that while we definitely are seeing about a 50-50 split, there may be additional individuals in the community that have not reported their results or are not getting tested and are either vaccinated or unvaccinated. Hospitalizations, Kallie can speak a little bit more towards the hospitalization, what's happening in the hospital system, but I wanted to share these data with you as well. And then moving into vaccine by first dose, you can continue to see that we are vaccinating individuals who've yet to receive a primary or a secondary of their first or second dose. So we continue to see individuals who are seeking a first dose, and that is really good news. We want to continue to see that. And again, these bolded numbers here indicate at least a 1% increase in the percentage of the number of individuals who've received a vaccine in this age group. Again, followed by our fully vaccinated. Again, we're seeing an increase in our 5 to 11-year-olds. That's good. We want to continue to see that and some of our other age groups as well. All right, so I want to shift to, we've added an additional table here and, no, sorry. I am struggling with my screen share today. Give me 1 second, everyone. Okay, sorry about that. So we wanted to shift a little bit to a new table where we were able to more accurately share with the community just the number of active cases happening in these different age groups that correspond to really those vaccine eligible age groups. And the primary reason we were doing this is just based on the number of cases that we are seeing in our school age children and amongst these different age groups. The reporting system we were using and the way we were pulling these data, we just weren't able to keep up to accurately reflect what was happening. This is a more accurate representation of the number of active cases we have in these particular age groups. And we reported them by active cases per 100,000. So basically what this is demonstrating that in the 5 to 11-year-old age range, we currently have 153 active cases. And what we do in public health, we try and make sure that when we're looking and comparing across, we try and create a common mechanism in which you can make those comparisons. So we looked at active cases per 100,000. And essentially what we've done is we've put the active cases per 100,000 as the numerator, the total number of residents as within that age group as a denominator. We divide and then we multiply by 100,000. So it just allows us to have a better comparison or a more equal comparison when you're looking at age groups like this. So you can see that our 12 to 17-year-olds and our 18 to 29-year-olds, we have the highest rate or the highest number of active cases per 100,000 in those age groups. So I wanted to just spend a moment to describe that table a little bit to you and also just explain why we shifted from the number of cases per individual schools to this age group to just allow the community to have a better understanding of what we're looking at in terms of active cases by different age groups. And then the last thing I'll share, and I kind of shared it at the very top of this discussion about our surveillance report, is that we continue to experience high community transmission. So with that means that we should, regardless of our vaccination status, be wearing a mask in indoor public places. And I'll continue to reiterate the importance of getting a vaccine. So if you haven't already received a vaccine, please do so. Make an appointment today. And with that, I will turn it over to Kallie to talk a little bit about hospitalizations.
Thank you. Sorry, having a little difficulty with my mute button there. But thank you so much, Lori. We currently have 14 COVID-19 positive patients at Deaconess Hospital. We do not have any COVID-19 positive patients at Big Sky Medical Center. Currently, our critical care unit at Deaconess has 20 beds and it's at 75% capacity. 5 of the 15 in the critical care unit are COVID-19 positive. And additionally, our medical unit is at 92% capacity, and our surgical unit is at 93% capacity. On the our clinic side of things and our testing side of things, our testing numbers continue to increase. Last week, as you saw in the graphs from Lori, just at Deaconess Hospital or Bozeman Health in general, last week, we processed approximately 4,486 swabs for COVID-19 testing alone. That doesn't include all of the other specimens we're processing for upper respiratory related illness. This week so far, we are collecting on average 550 swabs for COVID-19 testing per day. It's the highest collection demands we've experienced throughout the pandemic. We appreciate those who are patient and those who have understanding as we experience these extraordinarily high testing volumes. We are currently able to maintain result turnaround times of between 48 and 72 hours. However, just know that that's on average. And if the demand continues to increase for PCR testing specifically, our turnaround times may increase as well. Additionally, we've had challenges with our analyzers, and we do feel very fortunate to have a second analyzer in Big Sky. But whenever our analyzer goes down at Deaconess Hospital, which has happened twice recently, it causes additional delays in resulting specimens because we then have to divert all of our specimen resulting up to Big Sky. We know how frustrating this is, and we have been frustrated with it as well. And we'll continue to work tirelessly to prevent delays in specimen resulting. So we just want to really stress the importance of and thank those who are patient and kind during these very difficult times. Moving on a little bit, yesterday, the U.S. Supreme Court upheld the Centers for Medicare and Medicaid Services interim final rule, which requires COVID-19 vaccines for all healthcare staff. We are still waiting on the CMS deadline requirements, and it's important to note that we will follow regulations that apply to Bozeman Health. This is one that applies to Bozeman Health, and that's to remain in accordance with our mission and our #1 priority of keeping our employees, our patients, and the community we serve safe and healthy. As a health system, we strongly continue to encourage COVID-19 vaccination amongst everyone. Clinical evidence clearly demonstrates that the COVID-19 vaccine is the most effective way to prevent hospitalizations, deaths, and community transmission of the COVID-19 virus. It is also important to stay home when you have any signs of illness. Staying home when you don't feel well really helps prevent transmission of any respiratory illness. And all of those great things that we've been saying for quite some time now in healthcare, even before the pandemic, washing your hands regularly, wearing a mask, and continuing to socially distance are all important infection prevention measures. So thank you, and that's all that I have for today.
Thanks, Kallie. Tracey, do you have any updates from MSU?
No, Lori, I'm just here for questions today.
Okay. Well, with that, we'll go ahead and open it up to questions. Who wants to go first?
I'll go first if no one else wants to go first. Since Tracey, you're taking questions today, I know last semester at Montana State, we were eager to give students a somewhat normal semester that they haven't seen in a while. I guess what's the university's outlook, and how are they viewing next semester with the surge of cases right now?
Jonathan, so last semester, we had mask requirements for all the classrooms in all of the indoor spaces. On Wednesday morning, we announced that we'll continue that. So it's going to look very much like it did last semester, which is masks are required essentially everywhere indoors in campus. And we're continuing to offer on-campus vaccinations as well as on-campus testing. And so, you know, our goal is to the best of our ability, remain an in-person semester for the spring. So I'd say it's fundamentally all of the tools that we were using last semester will continue to use in the spring.
Thank you, Tracey.
Go ahead, Gabe.
Thank you. Gabe with the Exponent here. Tracey, will there be any vaccine incentive programs this semester for students similar to the Town Pump gift cards or raffle program?
Yeah, Gabe, those the fall vaccine incentive program was funded with the federal dollars, and we've gone through that. And so we don't have a vaccine incentive program for spring semester, other than we'll be messaging that it's a really smart thing to do. One thing I would say is that, you know, we saw an enormous entry into that incentive program when we first rolled it out. And then the number of students who enrolled in the incentive program really slowed down. And it feels like we may have basically reached saturation in the effectiveness of that program. And so we don't have an incentive program for the spring. What we have is our continued messaging on the importance and value of vaccinations.
Thank you.
Juliana, do you want to took your?
Yes, thank you. I did have a couple of questions. Lori, I was wondering, yesterday the governor announced those 650,000 tests that are going to be distributed county by county, and I was wondering if they've told you yet, like how many Gallatin County will receive and what that looks like.
Yeah, that's a great question. Thank you so much for asking that. Yes, I should say we are aware, just as you are, that there are additional tests coming to local jurisdictions for those over-the-counter at-home tests. I do not have much more additional information at this time. We're hoping for some additional information sometime in the middle of next week in terms of what that distribution plan looks like to different counties. So I don't have much more information than that right now.
Cool. Well, thank you.
Yeah.
And then Kallie, I was wondering with how many tests Bozeman Health has been doing the last week or so, if there's any work being done to kind of up capacity. I've seen some news from other states and counties of having National Guard come in to help with testing, and I'm curious if you guys are thinking about doing anything like that.
Yeah, we have explored in discussions about other options to supplement the work that we're doing. We really have extreme labor challenges with scaling, but we have made extreme efforts to open up our Lot H to have longer hours and to have more availability at the Lot H site. We are collecting in our clinics, and we're working to create a lot of touch points there. But we are looking for other types of solutions that we can partner with national programs and really are in good conversations with our partners at the health department to come up with additional plans.
Awesome. Thank you. And then Lori, I guess wanted to double check. Have you guys in the week since last week when I asked, gotten any other home tests from DPHS?
No, Juliana, we have not received any additional at-home test kits at this time. They're still on back order.
Cool. Thank you.
Yeah, thanks. Other questions out there today? Take another pause. All right. Well, thank you all for joining us. Holly, if you don't mind popping into the chat, we do have some additional vaccine clinics that are this weekend that we're standing up at the fairgrounds to complement the combined efforts at Bozeman Health and amongst our other partners in the community. Those were posted yesterday, I think it was yesterday. So I just wanted to make sure that the community is aware of them and that there are appointments available. And just wanting to, again, just encourage folks to get a vaccine, stay home when you're sick, and wear a mask when you're in indoor public places. So with that, again, thank you all for joining us, and be safe, and we'll see you again very soon. Take care.